Today we will talk about a very common complaint which the people have nowadays, that is memory problems. What we call in patient who comes with memory impairment, other features in elderly, the term what we give is dementia. Because many people in our practice, they do come young age, 20, 30 years, they say I have memory problems, do I suffer from dementia? That's a very big question to be asked. It's a very relevant question also because they have already read memory impairment means dementia. No, it's not like that. There are so many causes of memory impairment. To understand this better, we should know how our brain functions. See, if you see this, we have this frontal lobe, parietal lobe, occipital lobe and temporal lobe. And this frontal lobe is involved for thinking, memory, behavior and movement. Temporal lobe for learning and feelings, hearing. Parietal lobe for language and touch, and occipital lobe for vision. And this cerebellum is for balance and coordinations. The important thing is there are deeper structures also, like amygdala, which is important for emotions. There is a area called as hippocampus, which is an area for learning and memory also, and memory storage also. What is commonly found after the age of 60 years, the memory impairment, we have to have a very good evaluation on this entity. Dementia as a term, when we use, we just stamp it that you don't have any cure for this and it is irreversible. It is not like that. Dementia can be classified into reversible and irreversible entity. Just to check on reversible entity, see, at the age of 60-65, many people have hypertension, diabetes, thyroid problem, heart disease. They're getting already so many medications. These medicines can cause some derangement in the electrolytes, like decreased sodium on a long-term basis can make a person sluggish and poor memory. A person who is having a deficiency of vitamin B12, folic acid, can suffer from dementia, which is reversible. If you catch them early, it is reversible. Like hypothyroid, impaired function of the thyroid gland. You replace thyroid medicines, they will get better. But few conditions, like when the circulation is defective due to underlying cardiac cause, or maybe kidney is not having a high creatinine where the toxins are coming too much, then the mind can become groggy and they can have these memory problems. There are many drugs also which can cause dementia. Like for example, a person who is suffering from Parkinson's disease, 65-70 years, they usually recommend a drug called anticholinergics like triaxiphenydyl, benzexol. In those patients, we usually we don't give that because that decreases the acetylcholine levels and that can cause a memory problems and dementia. Those are the reversible causes of dementia. Certain CNS infection can cause dementia, but a big chunk of dementia nowadays after the 65 years of age is Alzheimer's disease, multiple small decreased blood supply at various times, they just have an additive effect and cause dementia, what we call as multi-infarct dementia. And the third is a mixed dementia, where Alzheimer's disease and multi-infarct dementia is a mixed picture, which is very, of course, common in Indian subcontinent. So what are the features of this dementia and why does this occur? Again, in most of the neurological disorder where the degeneration is occurring, the cause actually is not known. It can be long-standing, their poor diet, their uncontrolled sugar levels, hypertension, recurrent decreased blood supply to the brain, then nutritional factors which are prevalent where the levels of vitamin B12, folic acid is less. Even nowadays, vitamin D deficiency is another important aspect which has making its roadway in the cause of dementia. So, but in Alzheimer's disease, few people have familial Alzheimer's disease where some gene which is transmitted into the next generation and they can cause dementia at a earlier age. And the commonest picture of dementia is, most important is memory problems. Second, if you see before that, if you see the normal brain of a people, it is quite nicely built up, whereas in Alzheimer's disease it is showing a significant shrinkage. And if you see various aspects which are affected in Alzheimer's disease in addition to memory, it depends on which area of the brain is affected more. Usually in Alzheimer's disease, it's a temporal lobe and parietal lobe which are affected, and subsequently frontal lobe is also affected. So dementia also has further character, various causes like frontotemporal dementia is there. There are familial dementias are also there, and there are dementia associated with infections. So usually if you see this in normal people, these neurons are there which transmit the signals very nicely, and people can whatever information we want, the acquiring, the learning and storing also. Whereas in patients with Alzheimer's disease, this neurofibrillary tangle and amyloid plaques, what we call as, it's like a blocking the conduction across the channel. So the new learning is not there, but the old learning, usually the people of Alzheimer's disease, they forget the recent events. Short-term memory loss, what we call. Long-term, they may remember what has happened in their childhood, their village, their home in the past. But recent, they may not tell you what they have taken in the breakfast. One is the memory. Second is disorientation to the time and place. They may have, as the evening sets in, they might get confused. That's the second thing. Their executive functions will deteriorate. If the frontal lobe is too much involved, then of course behavioral disturbance can be there, like depression, agitation, hallucination, anxiety, restlessness. There may be few people we have checked, their behavioral disturbance are so much. They may not have memory disturbance that much they have the behavioral disturbance. That can be also a manifestation of Alzheimer's disease at the start. Usually then other things will start coming. Their speech can become deteriorated depending upon the stage. Usually Alzheimer's disease can go on for 8 to 10 years before the patient become bedridden and they die of some infection, bed sore or pneumonias or fractures. And the best part is, in the early stage when we catch, when we investigate, we have to always check. In these cases, we always get the blood test done to see for any deficiencies or any abnormality. Second, in most of the cases, we end up doing MRI of the brain to definitely note which area of the brain is shrunk, how much is the damage, or to rule out any. Sometimes a small tumor or multiple infarct can present in such Alzheimer's like picture. So once we label this, the psychological test, memory testing will be there to check how much memory is lost. Then we plan out what is the best option for this, because again we have many medicines to increase the levels of acetylcholine which are decreased in such cases, which is a very important chemical for memory. So we have donepezil medicine is there. We have what we call as cholinesterase inhibitors. Then there is also something called as memantine hydrochloride, which acts at a different mechanism. Neurotoxicity is decreased with this condition. Sometimes we give together, or sometimes we give in, as a start single drug. That is only one drug treatment which is available as far as Alzheimer's disease is concerned. But most important in treating Alzheimer's disease is a holistic approach, which is very important, because education of the family member is the most important thing. Like, say for example, first of all, appraisal that this is Alzheimer's disease, non-reversible, over a period of time it is going to increase. The family member should be accepting the fact, then they will actually in a better position to manage such individual, because we need to have proper lighting at home. You know, the way they walk, there should not be stumble. The bathrooms has to be taken care of so that they cannot slip easily. The latches of the bathroom has to be, you know, there should not be that, so that they don't lock up themselves. So we have seen people just they go out of the house and they wander. Sometimes they are not found also in couple of cases. So in that case, what we do, we give you know, the best recommended is iCard, or in many cases we even directly tattoo the people with the phone number and address, so that it is never lost. That is the second part. Third is the recreational facilities. You know, the more the people will be with the small kids, meeting the family member, going out of the garden with the, you know, nature, then regularly doing their walks at least, then they can be given small talks, you know, interactive talks, then few of the mathematical work, the reading work, you know, these all kind of a thing will keep your brain stimulated, and that's where you can ease out the, you know, treatment of Alzheimer's disease. And most another aspect is when the person is having mixed kind of a dementia, or there are various disease dementia which are rapidly progressive, where you cannot do much about it. Only how best we can manage as far as their nutrition is concerned, their multivitamins are concerned, they're taking care of their hygiene, preventing them from having a, you know, preventing them from falls and fracture, and treating small infections as well. So of course it's a very, very big topic for the day, but I think this should suffice for the day. Thank you so much.